My project is about type 2 diabetes. Me and my teammates split number 4, which is public health. For this part, I'm going to say the part that I chose, which is 3 and 5, social justice in action and progress report. Okay, so number 3, social justice. On this slide, I'm focusing on the connection between social justice and type 2 diabetes, especially in youth. There are major differences in how people experience this disease, and these differences aren't just medical. They're rooted in inequalities. Many young people with type 2 diabetes face challenges because of what we call the social determinant of health, which includes things like incomes, education, access to healthy food, housing, and even experiences with racism. These factors shape a person's ability to prevent the disease, receive care, and manage it day to day. According to an article that I read, Social Determinants of Health and Diabetes, a scientific review, the health system often does not provide equal care to everyone with type 2 diabetes. This creates what the author calls a deep-seated inequity. Sorry guys. Which goes against the principles of social justice when resources such as quality health care, education, or support are unevenly distributed, the outcome is predictable. Some groups suffer more because of these inequalities. Certain racial and ethnic groups and people with lower incomes experience higher rates of complications and even death from type 2 diabetes. These patterns aren't the result of personal failure, they are the result of structural barriers. The infographic on the left highlights the 5 struggles that youth with type 2 diabetes commonly face. The trauma of being diagnosed, fear complication, confusion about what causes the disease, difficulty with self-monitoring, and the need for strong social support. All of these struggles become even harder when a young person is already dealing with economic instability or discrimination. So, overall, this slide shows that type 2 diabetes is not just a health condition, it's a social justice issue. To truly address the disease, we have to address the inequities that shape who gets sick, who gets help, and who gets left behind. But on this slide, I'm explaining some real-world system failures that makes it harder to manage to prevent type 2 diabetes, especially in the low incomes and minorities communities. First, there's financial and access barriers. Insulin, diabetes medications, and monitoring devices are often too expensive, and many people don't have full insurance coverage. Since diabetes requires lifelong treatment, this leads to more complications and higher mortality rates. Second, we see issues with social determinants of health, especially food deserts. In many low-income neighborhoods, healthy food is hard to find, while cheaper, processed food are everywhere. This lack of access of nutritious options increases the risk of developing type 2 diabetes and makes it harder for patients to control their conditions. Finally, there are delays in diagnosis of suboptimal care. Standard screening tests often catches diabetes late, meaning people may live with high blood sugar for years without knowing. Implicit bias in the healthcare system can also contribute of these delays, making vulnerable groups even more at risk. Overall, this slide shows that type 2 diabetes outcomes are not just about individual behavior. They're deeply influenced by broader system failure that affects certain communities much more than others. Okay. Another strong real world example of a successful effort in diabetes care is the use of community health workers. These are people who come from the same communities as the patients, so they really understand the challenges that individuals face in their day-to-day lives. Because of this connection, they can build trust and communicate in a way that feels comfortable and culturally appropriate. In many programs across the U.S., community health workers help patients access important resources like healthy food and stable housing and transportation, things that have a huge impact on someone's ability to manage their diabetes. They also provide hands-on education about healthy eating, medication, and how to monitor blood sugar levels. What makes this approach so effective is that it addresses both the medical and social needs of the patient, and the results shows it. Programs that use community health workers have seen significant reductions in patients, meaning better glucose control and even fewer hospitalizations. This example shows how community based support can make a real difference in improving diabetes outcome. Okay. Action and progress report. On this slide, I'll be talking about the key actions and progress in public health effort to prevent type 2 diabetes. The main idea here is that preventing diabetes isn't just about individual choices. It requires a coordinated community effort that focuses on accessibility, early detection, and supportive environment. The slide highlights three major steps that have the strongest impacts. First, we have a large-scale early detection and screening program. These programs make it easier for people to get tested. Even they don't know the symptoms yet. Early detection is important because many people are pre-diabetic without knowing it. When the diabetes is caught early, health professionals can guide individuals towards lifestyle changes like eating healthier and increasing physical activities, and this can slow down or even prevent the disease from progressing. Second, we need to improve access to healthy food and active living space. This includes making nutritious foods are affordable and available, especially in areas known as food deserts where healthy choices are limited. It also means creating more opportunities for physical activities by providing things like walking paths, parks, fitness classes, and subsidized gym membership. This helps remove barriers that make it easier for people to stay active and manage their blood sugar levels. Lastly, the third step involves community programs that promote regular physical activity. These programs encourage adults to meet recommended activities level, such as 150 minutes of moderate exercises per week. Exercises is extremely effective. Not only does it immediately lower blood sugar, but over time it also improves the body ability to use insulin. It helps with weight control, This makes physical activity one of the most powerful tools for preventing type 2 diabetes. So overall, the message of this slide is that a strong public health approach featuring early detection, access to the healthy resources, and supportive community program can greatly reduce prevalence of type 2 diabetes. And that's it.